living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
In many rural communities, there simply aren't enough specialists to treat everyone who needs care. This is especially the case for people needing access to specialty care for their complex health conditions. My guest today will talk about a project underway in Montana and Wyoming that focuses on spreading knowledge and building care capacity in rural and underserved areas. Welcome to Healthy Living for Life. I'm Sarah Medley, your host. Welcome back. I'd like to introduce my guests, Dr. Christine McKibben, Associate Professor at the University of Wyoming and Director of the Wyoming Center on Aging, and Kevin Franke, ECHO Project Coordinator with Mountain Pacific Quality Health. Both will be talking about a special project, Project ECHO. Welcome to our show, both of you.
Thank you, Sarah.
So I'm going to start with you, Christine.
Sure.
You're with the University of Wyoming.
Mm-hmm.
Can you talk to our viewers about Project ECHO and the University of Wyoming, and what's your role?
Absolutely. Project ECHO, which stands for Extension for Community Healthcare Outcomes, is really an innovative continuing education and guided practice model that's really appropriate for a variety of providers throughout the healthcare system. So the goal of Project ECHO is to enhance the capacity of the workforce to deliver best practice care and reduce health disparities. So reducing disparities, for example, between urban and rural areas, say for a particular disease like diabetes. So at the heart of the ECHO model is a hub and spoke information sharing network. So if you think of it like a wheel, where you have a hub, which is an expert team, interprofessional expert team with a variety of providers who have the best evidence-based knowledge in, say, management of diabetes. And then that radiates out through a multi-point video conference to spoke sites, which may be practices or providers across health professions in rural communities. So the idea with the ECHO program is really to support these community providers in delivering best practice specialty care in areas where specialty care services may not be available. So my role is really an administrative one. So my role is largely to manage a team of faculty and staff that coordinate all aspects of the ECHO program. And we do anything from scheduling the ECHO program, recruiting the expert team members, to helping to recruit the spoke sites, providing technical assistance so that the providers' continuing education experience and guided practice experience is a smooth one.
How did Project ECHO get started?
Well, this is interesting. Really, it was born out of need. And so we saw that it was developed in the University of New Mexico Health Sciences Center by Dr. Sanjeev Arora. So Dr. Arora is a liver disease specialist with particular expertise in management of hepatitis C. At the time, in New Mexico, there were 2 clinics that were available with high level of expertise in treatment of hepatitis C. So you can imagine that the wait times were very long to see Dr. Arora, and those clinics are located in more urban areas, and there was just really a lack of specialty care in rural areas. So people had to travel many miles and wait long time for the opportunity to see Dr. Arora. So he felt fairly frustrated by this lack of specialty care in those rural areas, and people were coming to see him maybe later in the disease process than maybe would have been ideal for their health outcome. So Dr. Arora developed this Project ECHO, enrolled rural primary care providers in this program, and then co-managed hepatitis C with these providers through this information sharing network through video conferencing. Excitingly, in 2011, they found and published a paper in the New England Journal of Medicine about their findings that the care was really equivalent. So care that was provided in these rural areas by the primary care providers trained through ECHO was equivalent to that provided in the academic medical center. So with those spectacular findings, they wanted to expand the ECHO program. And in order to do that, they needed help to do that. So they developed a concept called the Super Hub. And the Super Hub is a center with extensive replication experience in the ECHO program, and that has a strong relationship with the original University of New Mexico team. And they are certified to provide additional training to other groups that want to implement a similar program, like, or actually ECHO program. So with that, the University of Wyoming, with their extensive experience in delivering the ECHO program, became a super hub and was certified to do so, and that was done in 2015. So the Center on Aging also delivers ECHO throughout Wyoming, and our particular role in the Center on Aging is really to improve evidence-based practice delivery in geriatrics across Wyoming, and so that's how we became involved.
So Kevin, can you talk briefly about Project ECHO in Montana and Wyoming?
Well, thank you, Sarah. Just like Christine said, it was born out of a need. The Mountain Pacific's work with our care coordination and our work with our providers throughout the states of Montana and Wyoming, we were working one-on-one with individual communities and working on the transitions care and the care coordination, which I'll talk about in just a little bit more depth. So bottom line is that we saw a need for the rural and the more frontier areas that we were not reaching at this point, and our partnership with the University of Wyoming was a perfect opportunity to do that.
Telehealth and telemedicine are widely used across the country. Stay tuned to learn the difference between Project ECHO and telehealth. Welcome back. Dr. Christine McKibben and Kevin Franke are still with us to discuss Rural Frontier Care Transitions Project ECHO. So Kevin, we were talking about Project ECHO in Montana and Wyoming. Let's finish that discussion.
Thank you, Sarah. You bet. And like I said before, it was basically born out of a need. Our work that we do with Mountain Pacific, with the states, we do it at a community level. And our whole goal is to build communities around the patient to make sure that the transitions from one level of care to another are taken care of, and we try to eliminate those gaps. We do it a lot in our previous work, but due to time and resources, at Mountain Pacific, we try to decide or figure out how we can get to those rural frontier areas of both our states, who are huge geographically, and we have lots of little communities out there that don't get the advantage of the education and a lot of the areas of expertise that we're allowed to, that we are able to give. We've had a strong partnership with the University of Wyoming and the Center on Aging from Mountain Pacific and us for a number of years, and we've been working on projects together, and we just thought this was a perfect opportunity for us to take the Project ECHO out into the field. One of the main things is that, in the original Project ECHO, it talked more about disease processes and more about specific disease, like it started it with hepatitis C. In care transitions and in care coordination, it's more about the process. It's more about the process from one area to the other. So what we're doing is helping coordinate that care in those smaller communities with those providers, and hopefully doing it the same way as we would do one-on-one with those providers that we were able to do it with.
So we talk about complex health conditions and we talk about ways of managing that. Can you talk about the work you're doing to help those patients?
You bet. Like I said before, many times, you know, when we're talking health conditions and in care transition, we give good medical care. We have good medical care in the states of Wyoming and Montana. But where the process and where it's broken down is in the process of care coordination. It's meaning, you know, somewhere in between the hospital and the primary care, between their hospital and home, between the primary care and the specialty physicians, there's that communication gap. There's three things and three barriers that always are on the forefront of being part of, you know, when we're talking care coordination, communication, education, and accountability. But when we talk about complex health conditions, we're talking about those people with diabetes who, you know, they need their care with their dietitian, they need their care with their diabetic educators, they need their care with their endocrinologist, their primary. Well, those are all areas where things can fall through the cracks. And so what we're trying to do is develop and help that process so that patient has a smooth transition from the other. Same way with heart failure. You have your cardiologist, you have your pulmonologist, you have your primary care. So all these areas, we're trying to help that transition from one level of care to another.
So Christine, talk to us about the difference between telehealth and Project ECHO.
Yes, well, telehealth works directly with a patient and is a direct link between a provider and a patient to manage a particular disease or illness or issue in that patient. Project ECHO is different in that it's working with a team of experts and providing education to providers as they manage their patients.
So Kevin, can you give us an example of a case that's actually used by Project ECHO?
Certainly, you know, in our sessions, it's about an hour, and at the beginning of each session, it's 30 minutes. We go over a case that's delivered as Christine said, from one of the spoke sites, and the expert hub. We all have this ahead of time, and so we're looking at recommendations, and so the case is presented, and then we have a short topic discussion and didactics. But an example of a case that I think is universal is, especially in our rural areas, is a patient that had come home was in the hospital 100 miles away at a regular tertiary acute care center and was discharged back home 100 miles away. Well, the patient was end-stage heart failure. The cardiologist had made numerous suggestions to the primary care on what could be done, whether it be palliative care or treat medically or so forth. But many times that gap and that communication between the specialists and the primary care and the family, or the primary care and the nurses, gets lost. And so what we try to do is look at the process, look at where it was at. And in this instance, the primary care did not get the information from the cardiologist. And so the continuum of care was broken right there, and so the patient was in influx. So what we do as expert teams, we give them suggestions. Did you try this? Did you work with the other areas or other resources? Did you look at all the other resources in your area to see what we could do? What is your process between communication between that cardiologist and your office? How does that work? Do you get everything? Do you get the discharge instructions? So what we do is we look at the areas in where the gaps were and try to fix them.
So you believe that you're really making a difference with Project ECHO in Montana and Wyoming. We just have a few seconds left.
Certainly, I believe from the recruitment and from the areas that we have been able to get to participate, we have had a number of areas, a number of care transition folks that have said, yes, thank you, we're getting the information now.
Thank you. Now that you know more about Project Echo, stay tuned to learn what a hospital in Dillon, Montana is doing to improve the transitions of care for their patients. We'll be right back. Welcome back. We are learning about how Project Echo can benefit clinicians and patients in Montana and Wyoming. Kevin Franke is still with us, and we're joined by Marie Hamilton, a registered nurse and ambulatory care coordinator at Barrett Hospital and Healthcare in Dillon, Montana. So welcome, Marie.
Thank you.
But before we talk to you, Marie, I want to have a follow-up conversation with Kevin. Project Echo is clearly making a difference to the citizens in Montana and Wyoming.
Certainly.
How is it funded?
You know, like I had said before, Mountain Pacific has been working with communities and providers throughout, but we were looking for that areas to reach those outskirts and the rural areas and the smaller communities. So Mountain Pacific, who we had the opportunity to write for a special innovation project through the Centers of Medicare and Medicaid services, and we were awarded some funding to be able to take care of this, to be able to work and partner with the University of Wyoming as a super hub, and we are doing this for the next 2 years. So we're funded for the next 2 years.
So let's talk to you, Marie. Can you talk to us about what you do at the hospital, and how did you get involved in Project Echo and Mountain Pacific's project?
So my role at the is a care coordinator. And as a care coordinator, I work with patients who have multiple illnesses or are on many medications. All of those are things that causes most people to have some kind of issue either with finances or with their health in general. And I work directly with the patients, usually to help them find the resources they need, or to, as I say to them, I'm their coach, and I encourage them to reach their health goals, help them figure out how to do that. I was thinking about that as I came over today about how did I get involved with Project Echo, because it kind of seemed like it just happened. But I think that I got a notice from Mountain Pacific saying, we're doing this, would you be interested? And at the time I was looking for some way I could figure out what resources were available in our community for our patients. And I thought, when I read through, I went, well, this is a really good resource. I'll just get a part of this. And so I reached out, and I've been doing it since.
Mm-hmm.
Yeah.
So you work clearly with inpatients and with outpatients. Talk to us about the greatest gaps you see.
So I think that the biggest gap that I see, especially coming from outpatient, is that they come home and then they don't really know what they're supposed to be doing, usually around medications. It's an interesting thing to me. We began a program called a Transition of Care program. And when I call the patients, it is interesting to me how often I find out that they've either missed a med or they're doubling up on a medication. And so I'm able to catch that, and I believe that we're helping them to be healthier and not be readmitted because they're doing their medications different from how it was. This is a national problem. It is not something new to us just because we're rural, but it is one of those things that we know if we send them home and they don't get it, and most of us don't coming out of a hospital, then they end up in trouble again. So I think it's one of our biggest ones. That, and really trying to figure out what resources do they need to be plugged in so that they can stay healthier at home.
So what's it really like to be part of an Echo session?
Well, it's really quite fun because you get to see everybody if they have a camera on their computer. So you do it from either your home or your office, depending on where it is, where you are at that time. You get on site, and you can hear everybody talk about what's going on. Usually the first half of the session is a case study where we get to hear about a situation, and then everybody can give input on how you might be able to solve that problem. within our rural communities. And that has been, to me, very beneficial because all of a sudden I'll go, oh, I hadn't even thought about those. And so it just is building my resource knowledge. Then the second half is a didactic learning time. And they always cover something that has to do with, oftentimes it's about medications and diseases. And so it's very beneficial to help us learn from some of the experts in the field.
So can you talk about one particular example where you know it's made a difference in the Dillon community? Project ECHO's really made that difference. Can you think of one?
Well, I would like to talk about a patient, and so it's going to be very global when I say this, but I was dealing with a patient that I was struggling figuring out how to help them. And about the same time, they asked me if I would present a case. And I said, well, I've got a case, but I don't even know how to begin talking about it because I am confused about where to go with it. And so as Abby and I talked about things, she said, you know what? I think you should talk to one of our members, Maya Pigliatori. Mm-hmm. And so she connected me up with Maya, and Maya was able to help me get some clarity on what was going on with this patient so that I could help him. So, without that resource, I wouldn't have known.
Kevin, so what if someone really wants to get involved with Project ECHO? Can you talk about who do they contact?
You bet. They can get on our website at Mountain Pacific, and we do have a webpage talking about the Rural Care Transition Project ECHO, and all the contact information is there on the thing. And it is free. It's a service that you can come in at any time. Like Maria had said, we learn from each other. And she's realizing that there's areas in Wyoming and Montana that we're all the same. We have a lot of us have the same problems, and we're working at it to figure it out.
Well, I'd like to thank Christine, Marie, and Kevin for being on our show today. And thank you at home for joining us. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.